Good morning, my name is Tania Fleitas Kanonnikoff. It is an honor for me to be here. I want to thank to the organizer for this great opportunity for sharing our project, especially to Florian that led us these minutes to present this interesting project, and Dr. Cervantes for his continuous support. These are my disclosures. And this is the agenda that I have prepared to share with you today. I want to talk about Legacy Consortium, which is the situation of gastric cancer in European and Latin American countries, which are the aims of our study, the work package description, which is a strategy through legacy clinical studies, and which is expected impact. So, Legacy Consortium is integrated by 11 sites, including 9 clinical centers from European and Latin American countries, a patient cancer association, and a bioinformatic enterprise. These sites are represented by their respective principal investigators, which includes Erika Ruiz from Mexico, INCAN, Marcelo Garrido, Universidad Católica Pontificia de Chile, Juan O'Connor, Instituto Alexander Fleming, Argentina, Sarah Derks, VU, University the Netherlands, Florian Lordick, University of Leipzig, Germany, Isabel Mane, the European Cancer Patient Coalition, Belgium, Fatima Carneiro, IPATIMUP, Portugal, Maria Alsina, the Valdebrun Institute of Oncology, Spain, Judith Farrez, Anaxomic, Spain, Carmelo Caballero, GenPat, Paraguay, Andrés Cervantes as the principal coordinator of the project, and me as the scientific coordinator from Incliva, Spain. This topic from Horizon 2020 arises from the dramatic prognosis of cancer worldwide expected in the next years. The situation is especially critical in low and middle income countries, where the incidence and mortality is expected to be increased in 75% in the next 10 years. Gastric cancer occupies the 6th position in incidence and the 5th in mortality, as we can see in the last data of GloboCan 2018. This incidence is especially high in Eastern Asia, but also in European and Latin American countries. The implementation of screening programs in some countries, as Japan, a country with high incidence of gastric cancer, result in a dramatic shift in the stage of diagnosis, with a reduction in gastric cancer-related mortality. Not only the early diagnosis, but also eradication of Helicobacter pylori have shown an impact of gastric cancer mortality in Japan. Conversely, Western countries with more restricted access to screening programs have seen a dramatic increase in gastric cancer incidence and mortality. Patients are diagnosed in advanced stage of the disease, where no strategies have improved so far the prognosis in locally advanced stage 3 and 4 gastric cancer in the last 2 decades. Therefore, an urgent intervention is needed. In addition, most studies and current international databases in late stage of the disease are largely based on Asian populations. Global epidemiologic analysis of gastric cancer in Latin American and European cohorts is needed to plan intervention actions that could improve the outcomes. A better stratification of stage 4 disease is required. Thanks to the knowledge acquired in molecular biology, we are currently able to identify those patients that potentially could benefit from chemotherapy or immunotherapy in the different clinical settings. Gastric cancer is complex due to the tumor heterogeneity. Moreover, standardization of the pathological, molecular, and immunoanalysis is needed to improve the therapeutic approach. Legacy projects arise from solidarity and international collaboration, seeking to establish common and cost-effective strategies that could improve the prognosis of gastric cancer. In this sense, the primary aim of Legacy project is to improve gastric cancer outcomes by applying personalized medicine at the 3 levels of prevention in European and CELAC countries, applying omics integrative epidemiology. Our strategy will impact in gastric cancer outcomes by working at the first level of prevention through educational material for the lay population on the risk factors of gastric cancer, creating a pilot of Helicobacter pylori registry, including a report on the therapeutic resistance for improving eradication strategies. At second level of prevention, by educating the lay population on the signs and symptoms of gastric cancer, facilitating access to endoscopy and implementing a prospective hospital-based gastric cancer registry for analyze the different causes of gastric cancer diagnosis delay. Finally, improving gastric cancer therapeutics approach through a better stratification of patients through a diagnosis algorithm and a consensus on the pathological report. Legacy project is structured in 7 work packages perfectly defined and interconnected. The first work package includes all the determinations that are going to be performed on the sample through a multi-omic profiling, which in connection with the epidemiological data will be integrated in the complex data analysis. And work package 4 is devoted to translate strategies that could improve gastric cancer outcomes in the clinical practice, and also to promote the scientific knowledge transfers and train the young researchers involved in the project. Work package 5 and 6 includes the communication and dissemination strategies, and work package 7 the ethical requirements. Moreover, these work packages are linked to 3 clinical studies that I will explain in the next slides. Legacy 1 is a case-control study focused on gastric cancer risk factors in European and Latin American countries, with the primary aims looking for identifying which are the risk factors associated with these populations, and also to identify the clinical, demographic, and epidemiological difference. We expect to recruit 800 cases and controls in this study. Legacy 2 is a cohort study focused on the advanced gastric cancer multi-omic approach, which includes the immunohistochemistry, the molecular, the immune, and the microbiome profile. This study plans to recruit 400 patients in 2 cohorts. The training cohort that will include all the characterizations and will be centralized in Europe in different sites, and the validation cohort where the common final cost-effective protocols will be replied in European and CELAC countries. The first results of our project are expected for September of next year, and the primary aims of these projects are to perform this multi-omic approach, then to identify which are the regional differences in European and Latin American countries, to identify biomarkers useful for the diagnosis algorithm, and to implement a pilot on a gastric cancer hospital-based registry. Legacy 3 is an interventional study of gastric cancer at the primary and secondary levels of prevention, where subjects will be asked to participate in a survey asking about their knowledge on gastric cancer risk factors and symptoms. After completing this survey, they will receive the intervention through a 3-minute video, and finally, 3 months later, the same survey will be repeated to analyze the impact on this intervention. Moreover, information will be provided through our patient brochures and the dissemination strategies of our project. Legacy 3 also contemplates the implementation of a pilot on the Helicobacter pylori registry, where the idea is to consider the therapeutics and resistance due to planned local strategy that could improve the outcomes. With this picture of Charles Bridge, I want to represent the expected impact from Legacy Project, building bridges through our multidisciplinary team and the international collaboration. Our educational program, the pilot of the hospital-based registry and the Helicobacter pylori registry in the different clinical sites, the consensus on the pathological report, and the development of a cost-effective, useful algorithm that could guide us at the clinic, is our purpose to impact on gastric cancer to be extended worldwide. Finally, You can see in this picture legacy researchers at the kickoff meeting last January in Valencia. Some of the researchers couldn't arrive because of logistic reasons, but I want to take the opportunity to thank all of them because of their tremendous effort in this project. This is possible because of their work and also thanks to the member of the advisory board. You can learn more regarding our project at our website. And thank you very much.